Hello, and today we're going to talk to you about our team. So we're going to introduce ourselves. We're the team of clinical nurse specialists working in neuro-oncology, and we're here to support you through your journey, and we are going to talk you through the different stages of which we're here to support you through. We're also here just if you want to chat, you want to pick up the phone. It's very difficult often to find out information about such a rare diagnosis as many of you will be experiencing. It's still very rare for us, some of the situations that come up, so we don't always have the answers. But the main part of our job and what we want to do for you is to find the answers, so you don't have to call multiple people searching for information, which we can hopefully provide you. And if we can't, we'll always be honest with you and say, we don't know, this is unusual, but perhaps we'll be able to find something that we can work together to make you feel better and get towards the information that you would like. We also like to signpost you to other places such as charities, which can be helpful. Your journey often starts with us in the pre-assessment clinic. So I'm going to hand over to Aeron, who Aeron and Sarah are very familiar faces in the pre-assessment clinic, but lots of you who've come through there will have seen them, to tell you a little bit about what you might experience there. Thank you, Aeron.
Hi everyone, it's Aeron, one of the clinical nurse specialists. I guess you guys will first hear our voices on a Friday afternoon when we call you to invite you for a pre-assessment clinic the Monday coming. This is when you meet the surgeons. They basically see your scan, discuss what they can see in your scan and our plans for you as a team. After that chat is when you actually you see the clinical nurse specialist, wherein we're going to sort of summarize or clear things that are not yet clear or are not clear in that discussion, and basically tell you as well about our contact details, our numbers, our email addresses and all that, and the things that you need to do on that day as well. Also, we aim to also give you some a list of key points to remember, because I know that sometimes in a clinic meeting, specific questions would come up after that clinic, and we just like to leave you with that key reminders on what to remember and what to take into consideration towards the surgery. So what else, Sarah, can you say?
I just think it's a really good opportunity for our patients to meet us, and really a lot of people find it very useful to sort of come and bring questions that they've kind of had over the weekend, and I think it's also useful to know that it's not necessarily kind of that pathway that Aeron's mentioned, that we would see you in that clinic. So it's a pre-surgical clinic essentially. So if you're in a position with your tumour where we've had discussions about surgery, the aim of this clinic is to meet you and discuss that surgery in depth. And I know we've got another video more specifically about that clinic, but it's just a really good opportunity for a sit down and a good chat really. And I think it'll be useful to hear from Jess and Ellie just about what other roles we have in the team and other clinics we're involved in.
So we see you in pre-assessment clinic, and then we will continue to keep in contact. Often we keep in contact with your family whilst you're in hospital. So we're not just here for you as a nursing team, we're here for your family as well, to support them through your surgical treatment, because it can be really tough for family and friends knowing that your family member is in hospital having an operation, finding out what's going on. We then pick up again with you after surgery to talk to you about results. So it will be us as the nursing team who will explain the pathology of the tumour with you and what we go on to next and the next steps. And then after the results meeting, if you're then going to have further oncology treatment in the form of radiotherapy and chemotherapy, our role then transitions over to Guy's, where we meet you at Guy's. And Jess, maybe we'll just talk about what we do to support you and your oncology treatment at Guy's from a nursing point of view.
Sure, yeah, of course. So once you've had your surgery and we've reviewed your pathology results in our multidisciplinary team meeting, we allocate a referral based on where you live. in your catchment area, and it could be Maidstone Hospital or East Kent Hospital. But if you're based around in London, then yeah, you'll come over to Guy's Cancer Centre, where you'll meet the oncologist and one of us who will be there to support you and your family through this. Based on your diagnosis, they will explain the treatment plan for you, and treatment is tailored to each patient individual, where we'll see how you are as a person, how your scans are, and your diagnosis, and tailor a plan from then. We will be here each step of the way throughout your treatment and after your treatment. You will meet so many of our teams, from the people in the radiotherapy team, occupational therapist, speech and language therapist, and physiotherapist. As and when, if you need them there, we are here. And if you need further support in the community, we're always here to help identify those needs and refer onwards if needed. So we can refer to counselling, benefits and welfare team, and if needed, the community palliative care team, district nurses, and linking with your GP, so we've got that good communication link so we can make sure you and the family are well supported. You would have MRI scans every 3 to 4 months to see how you're doing, how you're responding to treatment. And then after you've completed the treatment, you'll be followed up back at King's, where we'll keep a close, cautious eye on how you're doing as well, with further MRI scans and review under the team.
Thank you, everyone. I hope we've given you a little insight in what we can do for you and what we're here to offer. The most important thing to know is that the reason that we are here is for you. So it's to support you, whether you're a patient, a family member, somebody being referred into the service. We're here for advice. We're here just for an ear, sometimes just to listen to, where you don't have to worry about what you say. And we love a silly question. No questions are silly to us. So any questions you want to ask, please pick up the phone, because we always enjoy hearing from you. Thank you.